Hello, I'm Dr. Maitland from the Icahn School of Medicine at Mount Sinai in New York City. Today I'd like to review hot topics in systemic mastocytosis. And as an allergy immunology specialist who has been caring for patients with systemic mastocytosis, there are three things that really come to mind when I meet a patient who's waited years to secure a diagnosis to better explain the symptoms that they've been coping with for up to nearly a decade. First of all, the ability to understand that mastocytosis can cause problems in any single organ system. So it's really important that the patient has a quarterback to identify what might be problematic with them, whether it's gastrointestinal distress or it is neuropsychiatric issues like movability or brain fog, or recurrent skin symptoms, or an increasing presence of symptoms like mastocytosis spots that can cause disfiguring issues for especially young people. It would be important to understand that the practitioner looks beyond their own specialty and understands that there has to be coordination of care across many different disciplines, including having a pathologist who understands how to evaluate tissue that has been sent to them to look for the possibility of systemic mastocytosis. Also, I find that it's important that patients who have the diagnosis of systemic mastocytosis have an action plan that is essentially a doctor's prescription saying, this is how you treat anaphylaxis. These are the signs of anaphylaxis. These are medications to be avoided in individuals who show up in the emergency department, for instance, with pain syndromes, and they need relief, and that there are certain medications that are much better tolerated in individuals that have systemic mastocytosis, and there are medications that should be completely avoided in order to make sure that they don't get worse from therapies that are really trying to give them some relief. And then the third thing is important for the patients to wear a medical alert tag, identifying that they are at risk for having anaphylaxis because of their systemic mastocytosis. And on that medical alert tag, it says, this is what I have, this is how you contact me, and this is access to information so that you can receive the best treatment possible to reduce symptomatology and also minimize adverse events to any therapies that are administered. Please subscribe to Exchange CME's YouTube channel and check back regularly for updates about systemic mastocytosis.